Hello, I'm William Zoghbi. I'm the Chief of Cardiology here at Houston Methodist, and it's a pleasure to have today with us Dr. John Keaney. Dr. Keaney is the head of the Heart and Vascular Center at the University of Massachusetts, and he is also the editor for the cardiovascular disease section of the New England Journal of Medicine. John, great to have you here.
Great to be here.
Enjoyed your grand rounds very much.
Thank you very much.
And the grand rounds was about endothelium, endothelial function, some mechanisms, and also a clinical implication, I think, of all the research that you guys have done, and I think where the field is going. It's really very exciting.
Thanks very much.
Very, very exciting. And at times you see things that you're not predicting at first, or some of the other predictions. And I'm trying to, one, obviously, send our viewers to your grand rounds because it is so rich in so many ways. But I'd like to turn this into a bit of a clinical discussion as to what the implications are from our thought processes regarding endothelium and endothelial function. Few thoughts about antioxidants and everything else that initially was thought would be important for the endothelial function. Where are we there?
Sure. Well, I think most of that has played out, at least in terms of giving antioxidants to patients. There were multiple preclinical studies that provided considerable promise and encouragement about giving antioxidants to patients. But then, as is sometimes the case with developing ideas and paradigms, it didn't pan out in large-scale studies. The large-scale studies basically were essentially null. And I think I've always used that particular example when we talk to our trainees and people that we're trying to impart knowledge to, that you never really know the answer until you do the study.
Until you do the study, indeed.
Yeah. You can have a lot of preconceived notions. There are many things that are guaranteed to work, but they don't always work.
So some of these reactive oxygen species are important also for repair and so many other things that you just mentioned. So
right.
I think it's important to test it clinically and see what the end product is, at least with what we have at
That's
this
right.
stage of the game.
That's right. And we only have a limited number of tools that we can give patients anyway. So it's obviously very important to do so.
Should we test endothelial function clinically?
I don't know that clinically it's really needed at this stage. We have lots of predictive tools to help us identify patients who are at risk of subsequent events. And we have lots of very safe treatments that allow us to reduce risk, like statins, treating blood pressure, et cetera. So because we don't have a high risk for most of the preventive treatment that we do, trying to narrow things down is not quite as compelling as it would be if the treatments had more risk. That's also balanced with the idea that in order to test one's endothelium, the technical challenges and the ability to extrapolate those studies to the entire population are probably, in my opinion, limited. It requires a fair amount of expertise, and we don't have near the amount of normative data that we have for things like LDL cholesterol, blood pressure, and the like.
What is best to maintain the health of our endothelium? Is there something beyond risk factor modification or alertness to the traditional risk factors? I'm just going to say,
yes.
How does exercise do there?
So you stole my thunder, because exercise also exercises the endothelium. It increases the flow through your vessels. That turns on many adaptive pathways in your endothelium that improve the health of your blood vessel. It would limit the number of inflammatory cells that would be in your blood vessel. It makes them better at dilating, cuts down on their propensity to have calcium form in the vessels and atherosclerosis. So exercise is one of the things you can do that has a major impact on your endothelium and comes at little cost.
Exactly, and it's hard to measure, but
that's right.
It's hard to measure, meaning the effect, but we know it in almost every bed, cardiovascular, brain, everything else, I think, I mean, this is very important. Now, what happens with aging to the endothelium?
So with aging,
Because we say, well, you're as old as your vessels, at least for the people who are interested in,
Sure.
in the vasculature.
Sure. So aging is a phenomenon that's a little hard to pin down because it not only involves the passage of time, but it also involves the accumulation of injury. That's not always reversible. So with time, your blood vessels tend to have more in the way of inflexible components of the extracellular matrix versus flexible. They tend to have less elastin, a little more collagen, and their ability to compensate for increased flow and even injury is also limited. So time, I used to be an auto mechanic in the old days, and time is like mileage. There's no substitute, you can't make it go away.
Yes, indeed. And last thought, you showed us a tremendous influence of the nervous system, the peripheral nerves on the vasculature and on the endothelium. There are some interesting data also on stress, meaning not necessarily local, but in the cardiovascular system, maybe more inflammation. How do you put the relation of the nervous system on the vasculature, endothelium or otherwise?
Sure. So our data does indicate that crosstalk between the vessels and peripheral nerves can be quite important, to the extent that the function of the peripheral nerves or the balance of favorable versus unfavorable factors from the nervous system is impacted by stress. I could certainly envision a possibility where that would be effective. But just like exercise, stress is one of the very most difficult things to quantify for our patients because almost everybody feels as though they're under some level of stress, and comparing between patients can be quite difficult.
Interesting PET studies as of recent, looking at effect on the myocardium and vasculature and flow in individuals.
So those are acute mental stress where you're making people do
the cumulative effect.
Tough gymnastics with their mind. Yes, so I do agree that there's definitely a lot of interaction between the two systems. And for defined stress, as you pointed out, there's very good evidence that it has a local impact.
Any other departing thoughts? I think we've really enjoyed having you here.
I think my take-home message is we're learning more about the endothelium every day.
Well, it's great to have Dr. Keaney here with us. It's been a pleasure. We'd love you to take a look at his grand rounds, which was very informative.
And again, I thank you for the invitation, and it's been a great pleasure to be here.
Great to have you here.
Okay,
Great.
Very good.